Our next present is a comprehensive study on health and fitness among ophthalmologists in India. Dr. Janu Samsud.
आइए सर प्लीज एक मिनट
एक चेयर लगेगा
एक चेयर
Good morning, everyone. Today my paper is on a comprehensive study on health and fitness among ophthalmologists in India.
एक मिनट हाँ वन मोर जस्ट अ मोमेंट
एक शीट और लानी है को चेयर है
शी इज देयर
मैम एक
अब इनका टाइम
एक चेयर यहाँ पे रखवा दीजिए मैम एक चेयर यहाँ पे रखवा सर यहाँ पे यू कैन रीस्टार्ट द टाइम
Good morning, everyone. Today my paper is on a comprehensive study on health and fitness among ophthalmologists in India. So this work studies various factors related to health and fitness among ophthalmologists in India. It's a comprehensive questionnaire was created in Google form and distributed to ophthalmologists across country through various social media platforms during the time period between March 1 and May 1 of 2021. The questionnaire has addressed the various areas of work pattern, food consumption pattern, career satisfaction, fitness activity, occupational health hazards, and impact of COVID-19. So this survey is being taken up by 537 ophthalmologists across the country, out of which 76.91% were females. More than half of the respondents were working at government hospitals. As you can see from the graph, around 50% of the respondents were residents, 41% were consultants, and rest were fellows. While coming to the work pattern, 21.34% of respondents reported that they do not get at least one off day per week. 12% even reported that they have to work for more than 10 hours per day on a consistent basis. So comparing this with the statistics of developed countries wherein the working hours of doctors are less than 48 hours per week, we can see that Indian ophthalmologists are putting forward much more working hours. Working for longer hours on a consistent basis is associated with increased risk of hypertension, cardiovascular disease, and mental health disorders. 13% of the respondents reported that they do not get at least 6 hours of good night's sleep. This is again associated with a high chance of hypertension. While coming to the food consumption pattern, 44.13% of ophthalmologists regularly skip their meals due to work schedule. This is again associated with poor diet quality, increased risk of central adiposity, and insulin resistance. Despite this trend, it is promising to note that majority of ophthalmologists are trying to inculcate healthy dietary patterns. While coming to the fitness activity pattern, only less than half of ophthalmologists are having the habit of exercising regularly, and the most popular exercise activity is walking. Men were found to be more health conscious than women, and it is supported by the fact that male ophthalmologists are investing more time on fitness compared to females, consultant more than residents. A previous study conducted by Moore et al. Performed in general population found that youngsters spend more time on exercise. However, we are having contrary results, maybe because of the higher working hours that resident has to put forward. Females tend to spend lesser time on fitness activity due to the disproportionate domestic and parental responsibilities, especially in a country like India. Majority of the respondents find it difficult to allow time for fitness, mostly because of an inflexible workplace, work pressure, or simply because of lack of motivation. Discussing about occupational health hazard, a significant number, that is 57.16% of ophthalmologists are suffering from occupation-related neck and back pain, out of which 44% has resort to analgesics to relieve themselves from the pain. Females were found to be more suffering from occupation-related neck and back pain compared to males. All these findings were consistent with previous studies wherein it was found that prevalence of neck and back pain among ophthalmologists to be between 50 to 70%. We couldn't find any statistically significant difference between consultant and residents in this regard. This is contrary to the finding by Ramesh Venkatesh et al. That younger ophthalmologists are suffering from neck and back pain more than seniors, as they cater to more patients, work longer hours in OPD, and spend more time during procedures. It is saddening to note that almost everyone has gone through psychosocial stress or verbal abuse during their course of career. More than half of the respondents has contracted disease from the patients, the most common being COVID-19 and conjunctivitis. The list even include highly lethal diseases like tuberculosis. On the brighter side, 57.9% of respondents agree that the current COVID scenario made them invest more time on fitness. More than half of the respondents were satisfied with the protective gears provided by their institution with good confidence. Around 2/3 of the consultants has suffered from a pay cut during COVID-19. Despite of all this, it is quite promising to note that 64.04% of ophthalmologists are content with their career with good confidence. This is again comparable with similar studies conducted in Canada and Nigeria, and we couldn't find any gender bias when it comes to career satisfaction. Our study is limited by factors like inherent sampling error of any survey. Due to the open nature of the study, it may have caused non-response bias. Parameters like obesity and addiction are not assessed in the study. Despite of all this, we believe that the findings in the study can be utilized by the fraternity as well as the policymakers to enhance the quality of life of ophthalmologists. To conclude, majority of ophthalmologists suffer from occupational health hazard. Even though there is a strong desire to spend time on fitness activity, the majority find it difficult. COVID-19 hurt ophthalmologists due to salary cut and contraction of disease. Thank you.
Thank you. Good study, a good sample size, 557 of 37 ophthalmologists. Only thing is that probably it is more towards resident. 50% were residents, and I believe they are not from government sector, because in government sector there were no salary cut, but you were saying there's salary cut.
I was telling about only consultants, sir.
Only
Only consultants. 2/3 of consultants have suffered from salary cut.
okay. In government sector there was no salary cut.
But,
That may be
private
reason.
practice
Private
is
practitioner may be there. Definitely you must publish this paper. This is better, but it will be better if you also classify. You give male and female gender difference there, but young and yeah, consultant versus resident. And if you have something about their mental satisfaction, whether they satisfy the job,
Yeah, that I have
that
mentioned.
questionnaire is there too.
64% of
So
satisfaction.
the specific questionnaire should be used, which is provided by a psychologist or something. That's better. Anything?
Any questions from the panel?
Thank you.
Thank you. Congratulations. Nice